Let's talk about something that often manifests itself out of that upper cross syndrome. It's a condition called thoracic outlet syndrome, TOS. Now, it manifests itself two different ways. One is a vascular condition where it affects the flow of blood, and the other one is purely neurological. We're going to focus on the neurological one. But they both manifest themselves out of the same problem. So when we're looking at your spine right here, what you have is coming right through here is a big bundle of nerves called the brachial plexus. And you have a muscle that kind of fans itself into three pieces called the scalene, or the scaleni. And as it fans out, it has spaces between the three arms of it. And between the medial one and the front one, that brachial plexus comes out. And then the brachial plexus drops underneath your collarbone. So it drops underneath the collarbone, and it passes right between the collarbone and the first rib. It's kind of passing through here like that. And then what it does, it actually passes behind the pec minor, and it then goes out and innervates the arm. Now, sometimes we get compression of the clavicle and the first rib, which compresses that space in between, and that starts to compress that nerve. But other times it could be that tight pec minor that is tight, creating that anterior tilt of the scapula, is tightening up that space, and that also puts compression onto that brachial plexus. Either way, we're compressing that nerve, and again, if this is the vascular disease, that compresses the artery, which could then do what? Diminish blood flow and create clots and things of that nature. But we're just talking about the neurological. If I'm compressing the nerve, that is going to impede the transmission of nerve impulses down to the extremity, which means I might lose strength, sensation, circulation in my hands. That's generally a complaint of people that have thoracic outlet syndrome. So what we have to do for this is, first of all, it's that tight scalene muscle, these tight muscles around the neck that could be compressing it. It could be as it passes under the clavicle, it could be a problem. Or what often is the case is that very tight pec minor. So we've already talked about how to deal with the pec minor. If there's a problem as it passes under the clavicle, sometimes there's a small muscle they call the subclavian muscle that kind of creates the depression. So too much scapular depression sometimes can also be a problem, but that's usually very rare. Sometimes it might be where they have to come in and with a surgical procedure is remove some of the bone to create some space. That's usually not the situation. The situation is usually related to overactive muscles here and overactive muscles as the brachial plexus exits from the vertebral column. And so that's usually the muscles of the neck. So we talk about the scalene, the sternocleidomastoid, which is this big rope-like muscle. Talk about the levator scapulae, your traps. We want to stretch them all out, because if they can all have a little bit more lengthening, then there's creating more space, there's less compression in that area, and you have less chance of that nerve being compressed. So the easiest exercise we do is just a Scalene exercise, where you just simply take your hand across the top of your head and you're just going to pull exactly down the opposite direction. As you do that, take this hand and kind of drive that arm, because as I said, it attaches in the rib cage, so we want to take the rib cage away from us as we're pulling the head to the side. If you bring the head forward a little bit into the 45-degree angle, you get into the Levator scapula. Now that one's more at the back, so it's probably not going to be much of a cause, but I generally say just stretch that one out while you do. But I definitely want you to get these big rope-like muscles right here, the sternocleidomastoid, because they're the ones that hold you in this position. But because a lot of us have a head-forward position, these muscles have become very tight as well. So to get that, you're just going to take the heel of your palm, put it on your chin, and just push up and away. And here I'm stretching that one. Here I'm stretching that one. So a series of exercises you can do just to stretch out the neck muscles, right? And then we deal with what? That tight pec minor